Thanks everyone for coming. I'm going to start by acknowledging the country of which we are at, the Interworld land, and pay respect to the elders, past, present, and emerging, and acknowledge their contributions to society and conservation, as well as the traditional people of where Ama worked, which was primarily Fiji. Well, so today we have one of our very own, Ama, who handed in her PhD at the end of February? End of March, okay. And still waiting for feedback from her examiners any minutes, I would say. Yeah. And Ama did a really exciting and challenging PhD because it was sort of grounded in the real world in collaboration with so many organizations, especially the Wildlife Conservation Society. She had more supervisors than you probably should have. So she had to manage all of us. Helen was one of them. Hey, Anne, welcome. Yeah, she had supervisors across so many disciplines. She had people over the medical field as well as people here in the School of the Environment. So learned a lot about interdisciplinary science in that, but she did an absolutely fantastic PhD focusing on managing watersheds for not only coastal ecosystems, which is what we normally do, but she thought she'd just like up it and add managing, coastal ecosystems for public health as well. So I like to call it, she's trying to save the whole world. PhD. It's not just saving the environment, she's saving the people. So join me in welcoming Ama to give her, I guess, final PhD seminar.
Thank you, Carissa. So yeah, that saves me from talking about how I had 6 supervisors. One of the first points I was going to make was a super interdisciplinary project. And it feels really weird to come here and talk about my PhD at CBCS now after having attended CBCS seminars as a PhD student for so many years. But here I am. So as Carissa mentioned, I'm looking at watershed management for dual outcomes for human health and coastal ecosystems. I thought I'd start with talking about what watersheds are. So people call them catchments or basins as well. And they're basically the area of land that rainfall is collected over. So often this will be funneled into groundwater systems, into streams, rivers, lakes, and then sometimes downstream, all the way into the ocean where it might impact coastal ecosystems. So these settings of watersheds are really important for health all across the board. For human health, we use it, it's our source for drinking water, for recreation, and for ecosystems, it's really important in creating safe and healthy habitats as well. But as we know, there is vast amounts of human development in these spaces. We've got things like mining, sewage discharge, and all of these alter the quality of water and the quantity of water in some cases as they flow around the land and downstream onto coral reefs. So here's just an example of a global modeling study that was looking at one type of pollutant, just nitrogen from one type of human activity, so from wastewater, and we're seeing global impacts all across on land. The green bits are the impacts on land, the loading of nitrogen, and you've also got those impacts flowing downstream onto coastal. So it's a really widespread problem. Obviously, there's lots of different pollutants. This is just one example, but overall, a lot of these land-based pollutants are impacting coastal ecosystems. So for example, for coral reefs, you would get increases of disease, mortality. In some cases, you also get a complete shift in ecosystems where they might become less resilient to other threats, for example, climate change. You can also see decreases in critical ecosystem services, such as fisheries and sources of income and tourism. Overall, now globally, land-based pollution is a top-ranked threat for over 30% of coral reefs worldwide. That's from another modeling study. There's also huge impacts onto human health. I'm sure many people have heard that bad water quality is bad for human health. It causes infectious diseases, toxicity, and there's also the impacts that people might not talk about a lot, which is the downstream impacts from ecosystem declines. So when you've got poor water quality, not only might you be contaminated in your local environment, but you might see a lack of a decrease in the ecosystem services you're getting. Ecosystems. This is particularly bad in places where you've got low coverage of improved drinking water in the household, and also places where you've got a really tight connection with marine ecosystems or aquatic ecosystems. So overall, unsafe water is a major driver of diarrheal disease, for example, and this causes 9% of all deaths in children under the age of 5. So it's a really significant health burden. Support. So there are different approaches that different sectors use in managing poor water quality of the environment. So conservation, as Krista mentioned, a lot of the time for coral reefs, we'll look at integrated watershed management. So this would be looking upstream of coral reefs, looking at the different types of land use, what is generating the pollution that gets down to coral reefs, and trying to manage it there. So looking at how to minimize the generation of pollution and then how to minimize its spread. So for example, one method might be reforesting some of the hills or erosional areas to help reduce the amount of sediment that is flowing into streams and downstream to coral reefs. Unfortunately, while this has been implemented in a lot of places, there are actually limited examples of success for coral reefs. So we are not seeing improvements into coral reef health as an outcome. And this is for a lot of reasons. A lot of it will be to do with funding and scales. So it takes a long time for coral reefs to recover in some contexts. And you also might not have the funding to be able to monitor appropriately. There's also a lot of complexity in watersheds. There's usually a lot of sources of pollution. They're often very dispersed. They might be spread over a large area. So it's really hard to have the appropriate management to actually address water pollution and see outcomes at the other end. Then over the public health side, this might be slightly more common knowledge or intuitive. I have no idea how lost in the source of public health I am anymore, so I'm going to say it anyway. But most of the time, the foundational approach for public health is to improve WASH, which is water, sanitation, and hygiene. So these are approaches typically focused at the point of use at a household. So where people are getting their drinking water, their water for washing their hands, what kind of sanitation system they have. So if they've got improved toilets, and access to clean water for bathing and cooking and things. So these are really point of use, and they have had massive benefits for human health all over the world. But unfortunately, we still see high levels of pollution in the environment when you're just focusing on these household level interventions. And so there's cases where you have persistent waterborne disease, even when you improve WASH interventions. So for example, there are some lower income countries where they've installed improved WASH systems, but you're still seeing, and while there were decreases in waterborne disease, there are still 10 times the amount of waterborne disease infections compared to higher income places. And that's mainly because there's so much contamination in the environment that is not being addressed, for example, from livestock and zoonotic diseases. There's also the loss of critical ecosystem services, which is not considered when you're just focusing at the household and improving water quality for people's consumption or use directly. So there's an opportunity here for some collaboration where we might be able to improve the condition of our watersheds and manage the way we use land and our pollution to help coral reef ecosystems and also have safe water for people to access and use and move through, and then also improve those ecosystem services or maintain them. So opportunity to leverage action and motivate action as well, and pool funding and expertise and resources across these spaces. Unfortunately, there is a limited application of this kind of integrated holistic system in management, and that is where my PhD comes in. So I'm focusing on the Pacific Islands, as Krista mentioned, and particularly Fiji, which is highlighted here, and supporting watershed management for both of these different sectors. I'm focusing on the Pacific because it's really at the forefront of this issue. They have a quarter of the world's coral reefs, a lot of which are impacted by land-based pollution from things like increases in livestock and sewage pollution. There's also a really tight connection between human health and coral reef health, where in some places their coral reef fisheries provide up to 50% of the dietary protein for communities. There's also a really big reliance from communities directly on surface water, where up to 17% of people are using surface water directly for drinking or for washing and things like that. And we also have high cases of waterborne disease. So there's kind of a mix of issues here related to water quality and watersheds. So my project forms part of like a tiny little cog in this bigger project called the Watershed Interventions for Systems Health in Fiji. And it's kind of sister project, Kiwa, which is expanding the work from Fiji, extending it to the Solomons and Papua New Guinea as well. So this series of projects is looking at rural watersheds and trying to reduce water-related diseases in these areas, as well as improve coral reef health through a series of different interventions, but some of those include watershed management. So why my work is just supporting some of the watershed management strategy here. Oh, sorry. They also focus on 4 diseases, and these are really important in this area, particularly in Fiji. They've been identified as really environmentally important. Leptospirosis, typhoid, dengue, and diarrheal disease. I bolded leptospirosis and typhoid because after a lot of culling, I boldly decided to look at leptospirosis and typhoid for my PhD. 4 was just too many. So as an overview, I had 6 chapters in my PhD. I'm not going to be talking about all of them today in that much detail, but for the most part, we're talking about 2 to 5. So overall, the methods, the aim was to summarize some of the impacts to coral reefs and human health to identify, places to target, and also provide some modeling tools to help strategize different interventions in the watershed. So I started off chapter 2, I think, yes, was looking at summarizing the impacts. So this was just a really broad review looking at working with a bunch of different people who have worked in the coastal environment space, looking at improving water quality. So looking at people from the sanitation perspective as well as the conservation perspective, and looking at case studies where this has worked well, where it hasn't worked well, and where we can improve. And providing basically a state of the science summary for people who work in this area who might not be familiar. So a lot of different co-authors from different areas all around the world. This is focused on tropical countries, so a bit broader than the Pacific Islands too. So we first put together just a quick summary of what are some of the main land-based activities that are causing water pollution in coastal ecosystems in tropical countries. So this was a great infographic that was developed for the paper, looking at things like wastewater, for example, and how they contribute different types of pathogens into coastal ecosystems. So after that, what we did was put together a big table. This is just one little section of it. We went through each of the different types of main pollutants and looked at what are the different impacts to human health, and then what are the different impacts to human health. So this is just a summary of, for example, sediment pollution from land-based activities. And what we were looking at is not just human impacts from disease and things, but also if there were impacts to the cost of water treatments, and also impacts via the decline of coastal ecosystem services as well. So we're really trying to find out what is the suite of impacts across these sectors. Well, that was a summary of it. And then we provided some recommendations based on some of the case studies that we were looking at and the examples of success. So we came up with, in summary, about 5 recommendations. There's much more detail in the actual paper, but they were related to planning, coordinating, monitoring, scaling, and resource mobilization. But in general, all the recommendations under this were kind of capturing, taking a multi-sector systems approach. So looking at systems of health, not just human health, but also environmental health, to try to combine socio and ecological health together and get better outcomes overall. So for example, for coordinating, we were suggesting establishing a multi-sector management authority, for example, a watershed commission, and these would have the mandate and the ability to coordinate across different areas to implement strategies to improve water quality. So this was published, so there's a QR code there, but I'm not going to keep it on for long enough so you can scan. But there are some interesting blogs and other stuff that came out of this, which were quite interesting. If anyone is interested, I can link it to you. So then, moving right along, I got down into a little bit more of the nitty-gritty with a systematic review. So this was looking much more specifically at what are the drivers of watershed pollution or wastewater that we can look at that are impacting leptospirosis, typhoid, and coastal ecosystem health, particularly in the Pacific Islands. So I'm focusing here because these diseases are important here, and this work is specifically supporting some of the outcomes or decision-making in the WishWeG program. So I was really hoping to find out, are there some overlapping risk factors here? And are there potential management strategies, specific management strategies that we could use to help alleviate burdens from all of these different systems? So quickly, leptospirosis and typhoid, both waterborne infectious diseases. They're both bacterial, but leptospirosis is a zoonotic disease. So you get sick when an infected animal, you contact an infected animal, or that infected animal's urine contaminates soil and water, and you contact that soil and water. So this is that soil and water part of this is really important because that leptospirosis can survive in the environment for a really long time. So if that soil and water spreads, which it often does with rainfall and erosion, people can get contaminated far downstream from the source of infection as well. So it's a really strong environmental drivers for this disease. Typhoid is not zoonotic, but it's a fecal oral disease, so it's spread by contaminated feces, which can also spread throughout the environment. And there's increasing evidence that the movement of typhoid with soils and water across the watershed is important in driving outbreaks of disease as well. So both of them highly related to water quality, and there is increasing evidence that the movement of it across the watershed is important in driving outbreaks, but it hasn't been summarized with coral reef watershed drivers together. So I did the classic systematic literature review kind of thing, where I searched a bunch of databases, screened for relevance and quality using specific criteria. This was actually a massive pain because I was trying to use methods that are also appropriate for public health. which I didn't realize were extremely, they were a lot more detailed than what I was used to, but it was a very interesting experience and definitely opened my eyes into the massive amounts of literature that are specifically focused on how to do a good systematic review and how to do a good analysis, et cetera, et cetera. But because of the type of data I was able to extract and because of how different it all was, I couldn't actually do like a really detailed data extraction, effect, size, direction kind of plot, which you might like to do, which I want to originally. And instead I just summarized the findings by themes and also by direction of effect, which if anyone here is familiar, it's not the greatest output, but it's just getting a rough measure of are we getting health benefits or health declines from different risk factors. So after screening over 1,500 papers, we ended up with just 37, but there were heaps of investigations in each of these. So for example, a coral reef study might look at the impact of disturbed land, but then it would look at the outcomes on coral reef cover, on algal cover, on herbivorous fish abundance, on biomass. So you might end up with a lot of different indicators per paper, and each of those was considered a different investigation. And what I found that was really interesting for me, at least, was that while both disease and coastal ecosystem literature did look at watershed modification and wastewater discharge as a driver of disease, for the most part, disease literature just focused on exposure. So they were just interested in, are people exposed to surface waters through walking, swimming, things like that, not whether that water was actually contaminated or not. So that was by and large the focus of a lot of these studies. And even if they did look at a driver of poor water quality, for example, livestock presence, they did not look at them upstream. They just looked at them at the area that the humans were at, potentially at their household or just at the community. So there was very few cases where they were actually looking at agriculture or sewage, for example, upstream of communities and how that was driving disease, which was not great for me who was trying to find overlapping impacts. So what I ended up having was kind of just some suggestions based on the general risk factors that were identified. So we find a really strong driver of loss of vegetation across the diseases, impacts from livestock, particularly for leptospirosis because it's a zoonotic disease, and impacts from heavy rainfall and flooding. Those are pretty consistent. So clearly there is a huge role in erosion and rainfall in driving these diseases. So just generally, some suggestions for management were improved sanitation systems, best practice land use management to try to minimize erosion, and also livestock grazing management to try to minimize the amount of livestock getting closer to waterways and managing their wastewater as well. Then I got further into the woods looking specifically at leptospirosis. So we were interested in trying to model leptospirosis with consideration of some of the upstream drivers. So this leptospirosis has been modeled in Fiji before, for example, but they, for the most part, the focus has been on socio-demographic factors. So these are things like occupation, gender, as well as animal host factors. So whether you own livestock and things like that. Or if they're present very close to you. But I wanted to include some more environmental factors, such as soil erosion and the level of livestock upstream of you. And including those environmental factors basically means that we can start to then model environmental interventions or find out if environmental factors are actually a primary driver of disease in this region. So I use Bayesian network models to do this. This is just a little baby Bayesian network to illustrate how it works, but it's a probabilistic model. For example, here we're trying to predict contact with surface water, so the probability that you do or you don't. And that's driven here by just 3 input nodes, which are distance to river, so if you're close to it or not, or if you work outdoors. And the good thing about Bayesian networks is that these probabilities, so the outcome node, contact with surface water, is conditionally dependent on the input node. So whether you are living close to a river or not, for example. And so you can determine the probability of your output based on what's happening above you. And these probabilities can be determined via data, real data that you have, or by experts. So it's really great in a place where you have limited data, for example, in Fiji, where you have limited data for some of these things. You can use a mix of expert-derived data as well as real data that you have. It's also great because you can really clearly represent a structure for a complex system, for example, disease transmission, where you've got lots of different pathways influencing lots of different things. So that helps with representing a bit more of a causal system. So I kind of went about doing the Bayesian network in a relatively regular way, where you'd iteratively design the structure of the network with experts. So we had a look at the literature, collected the data, and talked to epidemiologists internally and also externally. They did a review of the Bayesian network to figure out whether we were representing the pathways correctly. And we wound up with a kind of base like this, where leptospirosis seroprevalence, and this is basically a metric of infection. So whether you've got antibodies for leptospirosis in your blood, which shows that you've been infected in the past. So that is influenced by whether you've been infected by animals or whether you've been infected by the environment. And each of those yellow nodes then had a big Bayesian network behind them that was much bigger and captured some of the inputs for that. So for example, this is infection from animals, primarily driven by whether you were exposed and whether those animals were infected. And then for infection from the environment, it was whether you were exposed and then whether that environment was contaminated. And so this section here, where I was looking at whether the environment was contaminated, that was a pretty new part, and I had to develop a separate model to try to represent that all across Fiji. So this is where we get to parameterization. Once we have the model, I used a huge range of data from census data, household questionnaires, environmental, globally available environmental data like elevation and things like that, as well as some expert elicitation. So I did have some major data gaps where I had to contact experts and do kind of iterative process to figure out what is the likely level of infection in cattle in Fiji, for example. But the main part of the parameterization that was novel, I guess, was developing a pathogen load proxy for leptospirosis. So we don't have data on leptospira, which is the bacteria, presence across Fiji. So I just developed a proxy based on what we know about it at the moment and how it moves around the environment. So I used some tools that are often used in ecological monitoring or modeling. The Natural Capital Project's Invest Sediment Delivery Ratio model. So this is a model that captures sediment delivery, considering hydrological features, land use, and different processes, as well as how it would be retained on land and flowing downstream. So this was important to capture how leptospirosis might travel across land as well, because it's often contaminating soil and will likely move with it. So I combined the outputs of that with a leptospira load model, which has been kind of used before, but only really coarsely, just looking at like the number of animals and what is the likely amount of cells they're producing, how much they urinate every day, things like that. So I did that with some pretty coarse population level data for different key animals. This is just cattle and pigs, 2 of them, but I included a couple more where I had data. And so that was used to develop a pathogen proxy, which was very interesting. That was actually kind of related to real seroprevalence. So I was super excited about that. But anyway, all of that work was just one tiny input into the model. And then I was really lucky I was able to validate the entire model output. So it's predictions of leptospirosis seroprevalence across Fiji against real data, which was collected by Colin Lau, one of my supervisors, who did this big epidemiological survey across Fiji in 2013. So I was able to compare my outputs with the real deal and see how it did. So what I found was that it had pretty poor model discrimination, which is basically the ability to figure out if to diagnose a case. So if there was a location based on the context there, does the person have leptospirosis or not? It was pretty bad at that. And this is not actually too untypical for leptospirosis models in this region as well. A lot of the others, it performs similarly to other ones. And that's because at a spatial level, you're not capturing a lot of variation that you have in disease. For example, through age and gender, those are very important in whether you get infected. But a spatial model like this just doesn't capture that level of detail. But we did have good or all right calibration. So this was looking at what is the probability of infection. The model did much better at this. So this is observed and predicted seroprevalence here. And what I found was, for the most part, it was pretty conservative. So in cases where you'd expect more disease, for example, if you are more exposed to animals, it typically underpredicted seroprevalence. Or in cases where you were less exposed to animals from the environment, it typically overpredicted. So it's relatively conservative. And what is great about these Bayesian networks is that you can also develop spatial maps. So I did that to try to figure out what the hotspots would be and if they align with our current understanding. So I mapped it in populated areas around Fiji. And it was pretty similar to some of the other outputs. But the good thing about this model is because it's got that causal network and it includes some of the environmental drivers, I was able to produce maps that also show where are the hotspots for indirect infection from the environment and where are the hotspots for direct infection from animals as well. These are really coarse because the maps that are driving these are national, really coarse census data for the most part. But it was getting somewhere to getting a little bit of an idea of the different types of drivers around the country. So then I Then I moved forward with prioritizing some of the interventions that could be feasible to help coral reefs and leptospirosis. So this was the application of that leptospirosis model. So I used before I get to the prioritization approach, I was looking at 3 different interventions, and this is using interventions that were specifically discussed with the Wish Fiji project. So they worked with a lot of communities in this area. This is Wakwella on the east coast of one of the main islands of Fiji, or one of the bigger islands here. And the red on the side is the location of coral reefs. And the green is just representing different types of land use. So we looked at reforestation of really erosional areas, forest protection of areas that might be cleared in the future, and riverbank stabilization. So this is planting better grass just on the riverbanks. And all of these are targeting sediment erosion and potentially the movement of leptospirosis across the watershed. And we compared it to a do-nothing scenario. And so I did a really coarse project prioritization protocol or project threat management approach, which is just looking at some of the cost benefits here. So here I assumed a feasibility of just 1 because these have been implemented in Fiji before at a small scale like this, and they were generally already okayed. The cost was approximated based on previous projects. It was really coarse, was not able to get really detailed cost data, but mainly capturing the magnitude of difference between the different interventions. And then for the benefit, I was trying to model what the difference would be between if you weight coral reef benefits more or leptospirosis benefits more. So I had a little weighting factor here. And the way I modeled coral improvement was using a pretty commonly used land sea linked model that's used in the Pacific. It is pretty good at it's pretty easy to use when you don't have that much data. So it just uses that sediment delivery ratio model that I mentioned before, and then has a diffusive plume to figure out into the ocean where that sediment is going and what coral reefs are being impacted or what area is being impacted. So I used that approach that's been used before to figure out improvements into coral reef health. And then I also used my Bayesian network model and adjusted some of the livestock and land use inputs into it to see how that changed leptospirosis infections. So what I found was that if you're weighting coral reefs more than humans, you end up with prioritizing reforestation, which this was the highest benefit and highest cost scenario. But if you're weighting coral reefs less than humans, then you end up prioritizing forest protection. And so this was the lowest cost, but the least benefit overall across corals and humans. But it had a higher benefit to humans than to corals relatively. Riverbank stabilization was never prioritized first. It was kind of middle of the run. Across it. So this was interesting. We saw basically some cost benefit trade-offs here, but this is really rough again. But one of the recommendations was this, that potentially the pooling of costs across these sectors might help alleviate some of these cost trade-offs and potentially also allow for the implementation of multiple of these interventions, which you probably see better benefits across both sectors for this. So main outcomes were basically that there is a very limited array of water resource assessment tools and management tools that are looking at coral reefs and human health for the most part. And I developed a modeling approach to help capture some of the environmental inputs into disease in the Pacific Island, particularly for waterborne diseases. And I provide a range of recommendations for trying to make a more holistic watershed management approach that looks at public health and conservation. And just thought I'd finish off because I had finished my PhD pretty recently. And things have definitely changed, but I do have some tips in general for if you're doing a PhD, if you're starting out. Industry placements, in case you don't know, I did one in Fiji, and it was just a really cool opportunity to kind of take a pause from my PhD, get a little extension, sometimes some funding to help cover your travel as well. There's a little travel scholarship that they have available now. And you can work in a different industry, and you're supposed to be doing work that's separate to your PhD project, pretty aligned with like kind of your topic though. So I worked with WCS, who I was working with for my PhD, but I was helping them with implementing a different project basically, which was really cool. I'd also recommend getting involved just in general. I put that pretty broadly. I was a HDR rat for CBCS and did some work with the previous school as well. And I really enjoyed that process just because I love to yap and it was great organizing pizza events and stuff like that. So would recommend that. I love doing it. Also, I should have ordered it slightly differently. When you meet lots of people, it's really great because you have a huge base to ask for help from. Especially if you're doing your PhD, everything changes every kind of like 3 weeks or something. So it's really helpful to talk to someone who's just done it before you to figure out how to go about the process. So if you're confused, it's fine. Probably other people are too. It's worth asking around. The other thing was that if you're doing an interdisciplinary project like this, get ready for a pretty steep learning curve. A lot of the time that I was doing this PhD was spent trying to read up on and understand public health research, which was really challenging, and I definitely got pretty lost in the source for that. But again, ask for help when you can to help kind of pull you out of the mud a little bit if you're feeling stuck and you're feeling completely hopeless. The other thing is get an ergonomic desk set up. My back is still barely recovering. And that's it.
Really big questions on that?
No.
No. Just a couple nice ones, really nice questions. Does anyone have any questions for Ama? Nice one, really nice one. It's a big page. Oh.
Yeah.
I would love if you could talk a little bit more about your experience, but like I'm inferring, but kind of coming from more of a science background and then moving into this sort of interaction with public health literature, because I think a lot of us are really aware that a lot of conservation problems are really integrated with people. But I think if you have a training in ecology, for example, you don't necessarily have the skills to engage with something like public health. So yeah, I'd just be curious to hear what that was like for you and any advice you have in general.
Yeah, I think it really differed depending on the kind of public health we were talking about. So for example, some of the work I was able to help out a little bit with a project with Amelia, looking specifically with sanitation people. And that was really interesting because it was kind of like a similar context where everybody was like, we have no funding, we want to do like kind of the bare minimum, we already know what we need to do, we need better toilets, we need less pollution. So everybody's kind of on the same side in that regard. But it was really interesting to talk to them because they did quickly identify like key bits of information that they needed. For example, like thresholds are really helpful for public health. So identifying like what do we need to get it down to kind of see like the best benefit or even like some benefit, especially when you've got a really limited amount of resources. So, and providing like different options for different types of contexts. So that was really important. So for example, if it's like as simple as like building your sewage effluent pipe like just slightly away from the coral reefs, and all the way ranging to like different systems where it's like, yeah, you need a wastewater treatment plant and then you need to hook up households to that and things like that. So they were really interested in kind of thresholds because they really wanted to get to like a minimum viable product, I guess, which was a bit different because a lot of the ecological research that I had been more familiar with, well, I'm more familiar with now, like some of the thresholds, but they're really hard to develop for an ecosystem. Some of them are available for like some specific contaminants and coral reefs, but it's really hard. So that was interesting that they were really after something like that, even if it's not like logically nice. And then it was different talking to waterborne disease people, like epidemiologists. They were similar kind of, everybody's like, doesn't have enough funding, things like that. But they have a lot of protocols or a lot of methods of doing research, which was really interesting. And I learned a lot by looking into their methods, I guess. Yeah, I would kind of suggest it to anyone to read like a methods paper of like how to do like avoid bias in your like research design from like a public health or epidemiological context, because they really go into like the nitty gritty of it, which is really cool. Obviously not all of it translates. There's some papers that kind of talk about like doing it a little bit better in like an environmental management context or like trying to meet different standards. And obviously it doesn't all work, but that was really interesting. I guess it's just kind of like speaking a kind of different language and trying to figure out how to, like they agree, like most of the time they're like, yes, ecosystems are important, but like sometimes it is a case of like we're all kind of struggling out here. Yeah. So I think trying to take the initiative and like reading up on like that as an ecologist.
Kath Lovelock has a question for you, along with comments on your talk, which are pouring in. Kath says, did you consider exclusion of stock from waterways?
Yes, I really wanted to want that as one of my interventions. So that's something that a lot of the community has also mentioned. So it is like one of the interventions. And it's particularly important in some places like American Samoa and Fiji, where you've got like piggeries, which is a big driver of leptospirosis. They're often like right on the river or right next to it. So you get like effluent directly into the waterways. So if they're upstream of you, that can have a big impact. I couldn't model it partly because of difficulties in understanding what the cost would be, as well as the differences in livestock density. I didn't have like high resolution enough data to be able to accurately represent like what the impacts would be of exclusion. So you might have like higher density somewhere else if you exclude them from one area. So it was like a lot of different assumptions. I decided to not model in the end, but it would be great to do that in future work. And it's like one of the recommendations in the discussion or whatever.
Yeah.
Thanks for sharing your journey with us. Great. When you had that slide about the interventions where you valued the coral reefs the same as human health.
Yes. Yeah.
So there was like reforestation versus protecting forests.
Yes. Like
Yeah.
these three. Yeah.
So that was interesting. But also, is there a time dynamic there where so it accounts for the
So there was a 10-year. I just had like a static like before and after of like 10 years interventions. Like what are the changes happening?
Yeah.
And yeah, this was very coarse because of that. It wasn't looking at like the 10 years was roughly the amount of time that it takes for seroprevalence to kind of like turn over because you get that in your antibodies for a long time. And it was like roughly the amount of time for some of the reforestation projects.
Thank you for the presentation. It's like a good things to combine the management sector between the public health and also conservation. And I want to ask like how you can provide a recommendation that balance their objective or their aims, because sometimes a recommendation can be more supporting in one side rather than balancing in the both side.
Yeah. I think that's a really good point. Some of what I was trying to do here is like looking at like if we try to balance both sides. Obviously, this doesn't do it that appropriately because you can't like apples and oranges. Like they're not equivalent. So it is really difficult to prioritize in this kind of a context. But if you're providing recommendations and trying to benefit both, it's really about trying to find those shared risk factors. And so a lot of the cases, if you're looking at a specific waterborne disease, which is sometimes how a public health management might work, you would have to look at what is a specific risk factor and kind of point to it and say, like, we have the same thing. So it's not about you coming to them and saying, you guys need to sort the sewage situation out, coral reefs are getting degraded. It's more about like, we have the same mutual problem. Maybe our conservation money should be going to help fund improved sewage systems. So allocating part of your resources, I guess. So I think it is trying to a lot of the work here is also about developing guidance and materials about having these conversations as well. So there's been like a sanitation practitioner's guide that was developed that I helped out with, which was just about how to talk to the different groups and have a shared language and figure out what might be the key areas to target that benefit both of you.
Yes. Can we just talk about what's happening on the ground? Because this was part of a small part of a humongous multi-billion-dollar project.
Yeah.
And what's happening and where is it going, sort of thing.
So there's a ongoing project that started, I think in like 2018, but it's been like in the works for a whole lot longer than that. And there's a really cool paper that talks about how it was developed, which I can send to anyone if they're interested in it. But it involved a huge process of going to different communities and getting basically a huge list of interventions of what they thought were the biggest issues in terms of their health and also their coral reefs downstream. So that involved like hundreds of different interventions and problems that they identified. And this project was really looking at systems health, so trying to improve the environmental health and human health within the context of a watershed for the most part, but it did end up expanding out. So for example, during COVID, they ended up kind of pivoting a lot and doing a lot of COVID management because that was a huge part of human health at the time. But a lot of the funding has been involved with basically understanding what the interventions and communities were after, trying to install some of them. So there has been a lot of livestock fencing, for example. So that would be providing livestock materials, as well as improving some of the committees. So there's like water management committees in Fiji, for example, improving those to be able to have either more resources or be able to have more people involved. So maybe the community health worker is meeting with the water committee to help improve the outcomes on both ends. There's also been changes to like reporting of leptospirosis and typhoid. So there's like a whole suite of different stuff that's happening, but including like installing new dams. So a lot of the cases they might not. There's one community that did get hooked up to metered treated water out of the project, which was really fantastic. But a lot of the other communities also had improvements to their dams. So for example, if their dams were not fenced and agriculture was able to access them, they would help them access them, or if they were being clogged up by sediments, they were basically reconstructed and then had sediment traps built into them, things like that. So that's where a lot of the kind of interest in finding out what would be kind of best for both goes, because we don't see outcomes from leptospirosis for a long time, and there's not that much monitoring.
Anything else? All right, thank you, Ama.
There's a note from Daniel in the chat that says it's a note to the crowd that we would love to see more NPHD talks. It's just so important to acknowledge the work that's been done, and also to thank you for everything. You've always set the bar at CBCS.
Yeah.